Virus that you political junkies will enjoy. Polyomavirus. And when you hear polyomavirus, I want you to think of politics. So polyomaviruses are naked, double-stranded DNA viruses. And there are two important viruses that are in the polyomavirus family that you should learn. The first is JC virus. With JC, I want you to think of Julius Caesar, the ultimate politician. And the second virus, BK virus, is going to be represented as Brutus's knife. For all of you not up to date on your history, Brutus betrayed and killed Caesar. So let's set our scene. For maximal cinematic effect, I'd like to set the scene of a Roman court with the political debate in full swing. You can see it's getting pretty heated in here. Notice it's in a large, round political hall painted with a cool shade of blue. And that's because it's a DNA virus. And more specifically, if you look carefully, you can see that we are carving a double-stranded DNA into the walls of our round room, to remind you that polyomavirus is a double-stranded DNA virus. The reason it's important to remember that it's a round room is that the DNA goes in a circle around the wall, because the DNA for polyomavirus is circular. So altogether, it's a circular, double-stranded DNA virus. And in the back of our room, we'll place another familiar character, our statue of David, in his full naked glory, to remind us that polyomavirus is a naked or non-enveloped virus. So don't get confused and think that the robes equal envelope virus, like they do in some of our other videos, the real players in the scene. Front and center, we'll place Julius Caesar, or JC virus. And just really quickly so you remember, his toga is falling off because it's a naked virus. So just in case you get asked or see this in an answer choice, JC actually stands for John Cunningham virus. The hallmark of our ruthless JC virus is that it causes progressive multifocal leukoencephalopathy, commonly abbreviated PML. And you can see the bust of Julius Caesar is labeled PML, so that you know PML is caused by JC virus. You may be surprised to hear that over half the population has JC virus, but it doesn't cause problems if your immune system is intact. But when your immune system gets tanked, particularly in HIV patients with CD4 counts less than 200, or patients on immunosuppressants, then it can reactivate and cause PML. Since it affects immunocompromised people, this is why we'll draw on the cane for Caesar. To help you remember that it affects people with CD4 counts less than 200, we'll write senator count is 200, which, depending on the era you're looking at, is how many senators were in the Roman Senate. PML is a demyelinating disease. It'll kill oligodendrocytes that produce myelin for the central nervous system. It happens throughout the CNS, hence it's multifocal, and it's progressive to the point where almost half of the patients who get it die within a few months. So this is why Julius is being killed. To represent multifocal brain lesions, we'll give Caesar a crown of white laurel leaves. Even his bust will have these white laurel leaves, which will represent brain lesions that light up on neuroimaging. And you should know that these are non-enhancing lesions, which is to differentiate it from toxoplasma, which causes ring-enhancing lesions. The leaves are white to remind you of leuko, as in leukoencephalopathy, which is dealing with disease of the white matter of the brain. As I said, leukoencephalopathy is a demyelinating process much like multiple sclerosis. So to remember this, look at the legs of the table that the bust is on. We made them look like myelinated neurons, and the wood grain is peeling off of them to make it look like they're being demyelinated. Okay, on to our other virus, BK virus, which will be represented by Brutus and his knife. Brutus has just surprised Caesar by betraying him and is stabbing him in the back. Actually, it's in his flank, and this is because BK virus is famous for causing nephropathy and other problems with the urinary tract. So just picture this wound right over Caesar's kidney, and you should remember that BK, or Brutus's knife, damages the kidney. It can also cause other problems with the urinary tract, including hemorrhagic cystitis. To help you remember this, we'll draw a cherubic little fountain friend over here who is peeing a bright red hemorrhagic stream. What other virus does this remind you of? If you said adenovirus, you'd be right. Recall how adenovirus causes hemorrhagic cystitis in young boys that go swimming. Now, the patients who classically suffer BK virus nephropathy are transplant patients, especially kidney and bone marrow transplant patients. A little fun fact is that BK is named after the initials of a renal transplant patient whose urine it was first isolated from. So to remind you of this association with transplant patients, on the table, we'll draw a large serving platter full of organs that are falling to the floor. This will remind you that organs in bone marrow transplant patients get BK virus nephropathy. So let's put these two viruses in a clinical context. First, a 40-year-old HIV patient complains of weakness, visual changes, and difficulty with speech, which has been getting worse over the past few weeks. CD4 count is 158, which is less than 200. You think there's something neurologic going on, so you get a brain scan, a CT or MRI, which shows multiple non-enhancing lesions throughout the brain. What should you be thinking of? That's right, JC virus and PML. Another stem could be a 50-year-old renal transplant patient taking immunosuppressants who presents with fever and gross hematuria. In this case, you'd be thinking BK virus. Alright, and that's all for